Good afternoon. I'm Alan Unell, and this series of videos is called Healthcare Advocacy, where we address problems in the healthcare system and then take action to make a better system for all of us. Before we get started, down below in the YouTube description box is a link to the Healthcare Advocacy newsletter that is the text for today's video. It has all the links to news stories and medical studies and references. It also has a host of resources, what to do if your medical claim is denied, or where do I go if I need an abortion, all kinds of stuff, as well as other groups that are pro-universal health care that you could join. And of course, you can subscribe for free. Let's get started. I want to talk about the state of Wyoming being hoisted on their own petard. Wyoming passed a "you can't tell me what to do" constitutional amendment in 2012 regarding bodily autonomy. What it says is that if you're a competent adult, that you have the fundamental right to make your own healthcare decisions. It was designed to counter the mandate of the Affordable Care Act that said that everyone had to have health insurance. That is, this would allow people to try and opt out of the mandate. Well, following the U.S. Supreme Court's overturning of Roe v. Wade, Wyoming then passed a near total abortion ban in the state, two of them actually, one on medical abortion and one on surgical abortion, I believe. It was, I think, the first prohibition on abortion pills nationwide. So, of course, they were sued about these abortion bans. And just this week, the Wyoming Supreme Court struck down the abortion bans because they violate the bodily autonomy clause of the Wyoming Constitution. All I've got to say is, ha ha ha, serves you right. Let me talk about Trump's lying tactics. This is another thing that showed up this end of last week. RFK Jr., the brainworm guy, made sure that the recommended childhood vaccinations were reduced from 17 to 11. The CDC now recommends that parents make a shared decision about those vaccinations with their healthcare provider. There's at least there's 6 of them that are they're for serious illnesses, and what the government has said is, well, if you're not sick, you don't need to get these vaccines. Here's the problem. If the vaccines are not mandatory, will insurance pay for it if you want it? Well, that's a good question, since many vaccines are very expensive. If you go to the pharmacy and ask for an RSV vaccine without insurance, you'll find it's about $300. Insurance companies typically cover mandated vaccinations. So, Trump made a speech yesterday, and Health and Human Services released a press statement. There's a link to the press statement in the newsletter, to placate concerned parents by telling them that, of course, insurance will cover recommended vaccines for children. Well, the weasel words in the statement were that insurance would cover recommended vaccines. If they decide your child is not sick enough, then it provides insurance a loophole to put the cost back on the parents. It sounds good on the surface, but it's a way to make people shut up and not pay attention to the damage that they're doing to our health insurance, our health care, and our health. This is a standard Trump tactic. Lie, use weasel words, say anything to get people to shut up and not thinking about the damage they're doing. It's much like the scene in the Blues Brothers where Jake is on his knees lying his heart out to his ex-girlfriend so she doesn't kill him. If you go to the newsletter, there's a link to that video clip, and you can laugh about that later. I want to talk about Medicare for all of us. I've received a number of comments from people about it, and I want to have some clarification. There are 2 bills in the 119th Congress that would provide all residents of the United States with health insurance. They're Representative Jayapal's H.R. 3069 and Senator Sanders' bill, Senate Bill 1655. Let me encourage you to peruse them. And if you go to the newsletter, there are links to the bills in Congress. You can go read them. I especially would encourage you to read H.R. 3069. It is the bill that I personally favor because the transition period is 2 years versus Senator Sanders' bill, which is a 4-year transition. And the reason I say this is because I've watched Republicans tear apart the Affordable Care Act bit by bit, starting almost immediately. And I think the faster the entire system is implemented, the more people will like it and the harder it will be for Congress to dismantle it. So what's in the bill? It includes a budget for a 5-year period to help those who have lost employment because of the bill. There are going to be a lot of insurance employees who lose their jobs because they're not going to be there to deny claims. It enrolls those over 55 and under 19 in the very first year. It will use the government healthcare exchange to offer coverage to anyone interested in having it in the first year, as well as to employers wishing to offer coverage to their employees. Insurance companies may not sell duplicative policies, but rest assured, they will offer optional policies to cover items not covered by Medicare for All. That's precisely what happened in Switzerland in 1995 when they implemented universal health care. I would also add that the insurance companies in Switzerland did incredibly well in the transition with those optional plans. They actually made a tremendous amount of money. H.R. 3069 offers global budgets to cover infrastructure costs for medical facilities to make sure they can stay open and serve communities. It also has regional administrators, and they will have budgets to help bring medical care to areas that lack coverage through capital improvement budgets and incentives for medical providers. All in all, it is a really well thought out plan. Since Americans shy away from the doctor when there are copays and deductibles, the plan is designed to operate without them. It's a plan to make Americans healthier by making sure they can go to the doctor and not go broke. It also saves the country about $750 billion in excess overhead and exorbitant prescription costs, because now the one major insurer will really have the power to negotiate prescription costs. As always, I welcome your comments and your questions, and I promise I will do my best to address them. But let's take an action. Let's remind our congresspersons and our senators and the president that the way to make America healthy is to make sure that we can all go to the doctor when we have to, and that we won't go broke doing it. I'll put a link to the phone number, to a website at Common Cause, so you can get the phone number and email for your representatives. Or, my favorite method, send a text message, sign PWR VFG to 50409. That's PWR VFG, all caps, to 50409. That's ResistBot. I'll read you the message that you'll send them. It'll shoot them an email right away. I'm your constituent, and I want you to read H.R. 3069. It is a bill designed to make America healthy and save us money. It is the Medicare for All Act. It offers a speedy transition to make sure all U.S. residents have health insurance within 2 years of passage, no deductibles or copays, and saves our country $750 billion in excess overhead and outsized prescription costs. It covers those that are displaced by the bill over a 5-year period. It makes sure that employers can offer it to employees, maintaining a very important workplace benefit. And it makes sure that insurance companies can offer optional policies to cover what the national plan may not cover. It even has designed in regional administrators with budgets to help make sure that medical deserts are eliminated so everyone will be able to go to the doctor easily. A recent Gallup poll revealed that 62% of Americans want their government to make sure that everyone has health insurance. 62%. I know the health of Americans is important to you. I want you and your legislative staff to read H.R. 3069 and then enact it so that we can really be as healthy as possible. Thank you. That's what I've got for you. Down below, you can like, share, subscribe, Send me comments here on YouTube or at healthcareadvocacy1@gmail.com. Thank you so much.